This talk is entitled 5 Things Every Great Receptionist Knows. And it's 5 themes, really, rather than 5 specific things. I think I'm probably going to cover about, 105 specific pieces of knowledge and behavior within 5 major themes. But I always start with this orientation slide that ultimately what we're trying to do here is the proactive pursuit of 4 outcomes by 4 roles within veterinary practice and looking at how reception fit within that. So ultimately, the 4 outcomes are good clinical outcomes, good client outcomes, good financial outcomes, and good team outcomes. And the 4 roles, V for vets, N for nurses, R for reception, and M for management. So these are the 4 outcomes, and we're going to look at how reception contribute to that. So the number one first thing I want to say is understanding the system in which you're working in. So here we have a depiction of our veterinary practice, and we have our pet owning public on the left, and we have our practice we're looking in through the window, and we're trying to achieve our clinical, client, financial, and colleague team outcomes. So I want to look at what I call the clinical client journey and the 3 stages of that, and how reception sort of, if you like, bookend the beginning and the end of that. So I call the 3 stages the preclinical contact, the clinical contact with the vets and the nurses, and the post-clinical contact. And reception are crucially the first and the last contact points that clients and pet owners have during a small animal client experience. Looking at specifics, so we have first contact. That might be the first contact ever with the practice, or maybe the first contact in this particular illness or query sequence. We register them. If they're not registered, that's what we're trying to do. We triage their need. That word triage comes from the French trier, to sort. So we put them into either whether they're urgent, non-urgent, or an emergency. So I define an emergency as you're coming down right now. Urgent means we'll see you today before we go home, but not necessarily right now. And non-urgent is when it suits us and suits them to be able to book that non-urgent appointment, and we schedule it accordingly. And then the client hopefully turns up and arrives and is waiting. The vets, usually it starts with the vet calling them through into their consultation. They may or may not be an admit of the patient, and the nurse is often involved in that, of course. And inpatients and outpatients generate invoices to the vets, and the nurses charge up the procedures, the consultations and procedures, and then they make their way back to reception, or you at reception pick them up and on the practice management system as the client is leaving the building, and you ask for payment, and in it goes. Some payments aren't direct. You have an indirect payment or a direct insurance claim, or healthcare plans are another form of indirect payment. And then crucially, unless we've euthanized a patient, we're always thinking, when will I see you again? And that's kind of one of the crucial things that reception should always be thinking about. Okay, when will we see you again? And making sure at the very least that the vaccination reminder is up to date. So there's the clinical client journey, and you're crucially at either end of that, and the vets are in the middle of it. So it's that communication between departments that's crucial. So the second thing, so that's the first thing I want to say, is actually understanding the system in which you're working in. So when I've got new receptionists, people who have maybe never worked in veterinary practice before, is I teach them, okay, this is what you're doing on the way in. This is what I need you to do on the way out. Because it can seem overwhelming whenever you can, people coming at you, phones ringing, all sorts of medicines and vets, and just it can be chaotic. So to help people learn and also to analyze and assess and coach, I look at, well, how are you doing in the preclinical? How are you doing in the postclinical part? So to be able to answer queries and field and triage and basically respond to a client, in other words, what's the difference between a veterinary receptionist and someone who, for example, just works in a hotel at the front desk? Well, you've got to understand something more about veterinary knowledge. So I use 2 acronyms to summarize this. I call my prevent it acronym and my resolve it acronym. Now, I'm not going to go through all of this in detail. I'm just going to basically say this is the absolute basic syllabus that a new receptionist needs to know with respect to the technical information that makes them a veterinary receptionist, as opposed to, for example, a hotel worker, a dental receptionist, a doctor receptionist, a dental, whatever it is. In other words, this actually is what you need to know to work in a vet's. So just summarizing that, prevent it. This was my made-up acronym. If you've done my courses, or if you do my courses, you'll know that I love acronyms. It helps me remember things. So P stands for what you need to know about your practice's preventative healthcare plans, what you need to know about reproduction and neutering. endoparasites, so worms, basic worms, how often, what products you're using, vaccinations, what we vaccinate dogs, cats, rabbits about roughly, how frequently, so you can understand when clients ask you about these things. I don't expect you to be an expert, but we do expect to have some sense of how frequently we would vaccinate dogs, cats, and rabbits and what for. Ectoparasites, fleas, ticks, lice, and mites, understanding the products, understanding the basics of even, for example, fleas. We have to treat the environment. 95% of the problem is in the environment, not the actual adult fleas. If you sell food, you'll have to have some sense of the ages, the breeds, the sizes, and the formulations you've got to help people make some sort of choice. Basics about dentistry, certainly insurance you'll be asked about or involved in processing, identification, so microchipping, registering that, any basics on training and habituation. Now, I don't expect you to start going into behavioral consults, but just under an awareness of how puppies need to be exposed during that early stages of their life. So these are the basics of preventative healthcare that you'll be certainly engaged in handling the products, making appointments for. And then resolve it is for sicking animals. So we're trying to resolve symptoms. So symptoms are abnormal observations, i.e., when animals are ill. So recognizing symptoms and recommending appointments. So the moment you hear anybody referring to anything that's abnormal, so cough, sneeze, vomit, limp, scratch, lump, diarrhea, not eating, these are not normal, i.e., they're symptoms. Your default response is, okay, let's get you booked in. If you're going to be able to have to triage, you have to understand what emergencies, what represent emergencies. And again, I use the emergencies word as an acronym. And if you see for each of the letters, I'm not going to go through it, we don't have time, but it's in the course, is if you see any of these or hear any of these, let's get you booked in right now. Successions is a fancy way of saying clients changing practices, second opinions, getting notes in the protocol for that, ops and admits, fielding lab reports, so getting them if they're coming back from email or integration into your management system, so getting them to the right vet, organizing and discussing home visits, certainly euthanasia when clients talk about it sensitively, knowing what the options are with the body afterwards and how to handle ashes back. Inpatient queries when clients phone up and ask how their pets are getting on after their operation. And therapeutics is all about medicines. So knowing will you be involved in dispensing and having a rough idea of what the basic medicines are. So these are the basic pieces of technical information that I cover in my first month of syllabus whenever I'm training a new receptionist. Number 3, handling clients at first contact, and any contact really, but often on the phone, and converting contact to consult. Receptionist job, if you used to think about what veterinary practice was before it became all very sophisticated and complicated, it used to be a telephone and a till. That's what reception used to work. They answered the telephone, they booked in for the vets did their thing, and then basically you took payment into the till on the way out. And so your first absolute crucial receptionist behavior is to convert contact to consult. The default answer to every question really is, okay, let's get you booked in, until that is not the right answer. So some tips and tactics about how we do that at that first contact of the preclinical contact. So what do we want from reception? We want a prompt, polite, purposeful progress. That's what I think of my reception. I want them to be prompt. In other words, I don't want them to answer the phone, preferably within 3 to 6 rings. Increasingly, practices are taking the phones away from the front desk, so you have much less distraction and much more focus on people in front of you. But if you're involved in answering or fielding telephone, so promptly people often say within 3 rings. I mean, whoever said that didn't work in veterinary practice. I think 6 rings is fine. But if the phone rings more than 10 times, people do start getting a little irritated and frustrated. So polite, your salutation, good morning, such and such vets, Brian speaking, how can I help? In other words, it's just a polite way of coming across as professional. So purposeful means let's get sorted on their problem, identify their need or their problem, and let's get it sorted. Most of the time, it's booking in a consult. But there's 4 actions. So book in consult, book in an op, book in a request for an ongoing medication, or the last thing we do is book in a vet call back to the client. 95% of the actions that you'll do, you'll be one of those 4 things: consult, op, medicine request, call for the vet. So and making progress, helping people understand what their options are. It might be you've got a couple of options, and we'll look, for example, if they say, how do I go about getting my puppy vaccinated, or how do I pay, or how much does it cost, and we'll look at it in a moment. There may not be two options. Maybe, okay, let's get you sorted, let's get you booked in. So take control and command of it. What you want at the end of by the time you put that phone down is to have booked the client in onto your diary. That is what we want, if that's the right thing to do. Now, we know not all calls are that, but that's the preferred way of dealing with it, onto the diary. So to do that, we need to actively listen. So actively listen is a psychological concept, and it means when you're listening to people, you're listening out for pieces of information that you know that you're going to need in order to make progress with the call. So one of the first thing really is, who are we talking to, and are they registered with us? So you want to know. So now some clients are brilliant. They go, oh, hello, it's Jane Smith, Scooby's owner, and they tell you that. Others will go, hello, it's me. And I'm always amazed at how receptionists often recognize the voice and say, oh, Mrs. Smith, Scooby. And so you may have a telephone system that, of course, connects to your PMS and says, okay, we know this is Mrs. Smith calling because of the connection. I tend not to ask my receptionist to say, are you registered with this? Because clients who've been with you forever, they get a bit almost frustrated, and they sort of think you don't know what you're talking about. I've even had clients who say, oh, put me on to someone who knows me then. So a better question is, what surname is your pet registered under? Now, you may say, well, that's odd, I don't know if they're registered yet. But 99% of the time you say, what surname are you registered under? The people who are not registered usually say, oh, I'm not registered yet. I know you're going to say, we've had somebody, you spent 5-10 minutes on the management system trying to find somebody, and they go, oh, I'm not registered with you. But that sometimes comes down to us just having a sense of, are they registered? So what surname is your pet registered? Because you may have Miss Jones who lives with Mr. Smith, and maybe it's under her name, but he's calling and you can't find. If you say, what's your surname? He'll say Smith, and you can't find it. So it's just a very efficient way of asking various questions. What's the right surname, and are you registered with us? And when you're doing the search, I tend to put in the 3 letters of the client name and the pet name. So, and then that brings up the search filter. And then I tend to say, can you just confirm your address, please? 29 Castle Road. Yep, I've got you. Let's get you booked in. If they're not registered, reassure them as to how easy it is to register your practice. No problem. We can do that right now. It takes a couple of minutes. Because people often think they have to maybe fill in some sort of form. You may or may not ask them to do it online, but most practices will do it over the phone. People think it's as complicated as opening a bank account. We all know how complicated that is. So make them realize it's really easy. No problem at all. We can do that for you right now. Let's get you booked in. So by the time you put the phone down, they're registered. They're booked in for that consult that you want. So as I say, there's 4 things that tend to be the core actions. And in preference, obviously, if you've got an op to book in, you book in an op. But the preference is book the appointment rather than booking a callback for the vets to talk about something. So whenever clients talk about symptoms, or as I say, contact to consult. So a nice little phrase to move along is, okay, bless him, he doesn't sound very happy. Let's get an appointment with the vet. Let's get that sorted for you. You're leading purposefully to what you want to do. And a really good way of taking whether we're going to book an appointment is to shift the conversation to, I've got one today at 10 or tomorrow at 12 or 2. In other words, whatever it is, move it to whether to when. I've got one today at 10 or I've got one at 4. What suits you best? People tend to then move the agenda and move on. You sometimes get the person who wants to tell you their life history. They go on and on and on and on. So I encourage polite interruptions. And a polite interruption is an interruption, but normally after, say, 45, 60 seconds, I let them chat if it's not going anywhere. And the polite interruption, as opposed to a rude interruption, is to use something that they said and that makes them what they've said sound important. So that I tend to say, oh, I'm really sorry to interrupt you, but just what you said about his diarrhea with the blood in, certainly that does sound something like we need to have a look at. So let's get you booked in and move to strike, move to get them on the diary. So it use something they've said, and therefore it makes it sound that what they're saying is important, and it's a good way rather than actually just stop talking, let me get on with my job. Sometimes I'll ask for the call for the vet. So a useful phrase is, well, vets have told us to book an appointment for those symptoms. In other words, I appreciate, Brian has told us, John has told us, Jane has told us, always to book an appointment for those symptoms. I'm pretty sure that's what they'll want me to do. Sometimes they'll ask you for advice, Or they'll ask you, is it okay if I do this thing? Should I feed him a light diet for a day or two and see? And the answer to that is you don't know. You don't want to say, yeah, feed him a light diet. Sure, if you want to do that, no problem. Because I can tell you what they say 3 or 4 days later in the consult is, your receptionist said I should feed him a light diet. I say to my clients, I bloom and hope not. In other words, I know my receptionist did not say that. But what they're trying to do is twist it to, that's why I didn't come sooner. So the receptionist answer is, whilst that may be all that is needed, only the vets can give you that advice, and they'll only do that after they've ruled out more serious causes. So that's how you get out of that. Contact a consult. That's your purpose in this phone call. Handling price and cost queries, of course, understandably, like all of us, whenever we're engaging with a service, we want to have some sense of what it's going to cost us. So they'll often ask, how much does it cost for some things? So we've got our crib sheet behind reception, and it's a very simple little sheet. And the rule is, if the price is on that for the pretty fixed things, consultations, euthanasia's clause, vaccinations, neuterings, the fixed price items, if it's on that, you can give that price. But if they say something maybe more generally like, let's just go sideways. Sometimes, though, we have to be a little bit more cunning as to how we convert a price query to a registration and an actual appointment. So the classic is how much you charge for a puppy, kitten, or whatever it is, vaccination, potentially for a neutering as well. I've never been to you before, but how much you charge for? And this is for something that's a fixed price, puppy vax classically. Saying, well, whatever it is, £100, £150, whatever it is, doesn't tend to be the most effective way of getting them to register and book in. Even though you've answered exactly the question they've asked, you need to be a little bit more cunning and say, what I want from the end of this call is to register this client and get them booked in. So a much better way is to engage into a bit of conversation, a little bit of sugar if you want. Oh, how lovely. You got a new puppy. That's great. Okay, so the price depends on what your puppy needs, because that's true. You don't know if this puppy needs one vaccine or two yet. So the price depends on what your puppy needs. Do you mind if I ask you a few questions about your puppy so I can give you the right price? That sounds much more, okay, well, that makes sense. And actually now we're opening a bit of a conversation. I suggest not asking more than 3 questions before you give them some sort of price. Otherwise, they'll think it's the Spanish Inquisition and they'll go, oh, for goodness sake, just give me a price, please. Has your puppy had any vaccines yet? If it's not, okay, going to need a course. How old? Bit of conversation. Okay, when we know the first vaccine's at 8 weeks. Out of interest, what breed? That might be more conversational than technical. It doesn't actually matter really about the price and the breed, does it? Cockapoo, of course. What name? I had once a client saying to me, can I ask you a question? Do you charge different prices depending on what the puppy's called? And I went, what? And he said, well, I was calling around practices. And I asked, how much is your puppy course? And the receptionist said, oh, what's your puppy's name? And the guy was baffled. He said, I don't know. You tell me the cheapest name. I'll call it that. So if we want to go with this slightly conversational, making contact, make sure we do it in a logical fashion. Don't ask the name or the breed even as your first question. Kind of come into the conversation at the right time. So a good question to start with is, has your puppy had any vaccines yet? And then you can decide, is it just a single or a course that they need? So say you find out, you then say, okay, to summarize your need, okay, Molly, the puppy, needs her full course of vaccinations. The first one's at 8 weeks. The second one's at 4 weeks later. There is no 2 weeks later. Lepto 2 is gone now. So 4 weeks later, and that's what it is. So you've got a couple of options. Now, this is a very good way of now moving into the healthcare plan. We have to be succinct, though. You've got a couple of options. It's really good when you give clients more than one option to tell them how many options you're about to give them. And I suggest not giving them more than 3. So you've got 2 options, might be 3 for something else. You've got 3. So option number 1 is pay as you go. So paying as you go, you can pay the course and the course costs £150. Option number 2 is we also include that vaccination in our healthcare plan. So what our healthcare plan is, and then you need to be able to succinctly describe the healthcare plan in fewer than 50 words. You don't want to go into a long-winded conversation. This client's going, oh, goodness, this is turning into complicated. I just wanted a price. So you very much go, okay, pay as you go, or our healthcare plan. What that does is bind together our vaccinations with parasite control, and you pay X pounds a month. You may or may not, of course, have consultations included, depending on what your healthcare plan does. So you've got a couple of options. And then the final thing you say is, do you want me to book that appointment now? I can register you right now, get Molly registered and book that appointment right now. So you make your call to action and they have to either say yes or no. If they say yes, well done, get it registered, get it booked in, well done you. If they say no, you might even want to email them some information potentially. But, make the call to action. Don't wait for them to say, okay, I'll book in or I'll not. Clients, of course, ask for prices about more vague things. How much do you charge for a dental? Well, it depends, of course, on the dentistry. How much do you charge to have a lump off? Well, there's many variables in that as to what you do. So our rule is, if it isn't an exact price on that cheat sheet that you've got behind reception, please don't even start talking about prices. Don't even guess, because guesses cause confusion later. Either you guess defensively, as I call it, you guess a really big number and they go, goodness. So if you say, oh, well, most dentals tend to be under £1,000, they go, but down the road was charging me 350. I thought that was a lot. £1,000 with you, even though you might go, well, it might not be £1,000, it might be 250. Don't give the worst case scenario, because actually what it does is often scare them off. What you really want to do is actually get them booked in. So if somebody says, I've been to the vet down the road, they say my dog needs a dental, fair enough. I'm just really surprised at how much it's going to cost. How much do you charge for a dental? You may have fixed price dentistry. Not most practices don't charge the same for a D scale as a full mouth extraction. So the way I handle that is say, okay, honestly, the way we really need to do that is to be able to see your pet, to have an examination, assess the teeth, to be able to give you a decent price. Now, I know that might be a bit inconvenient for you. I kind of call them on it and I kind of go, I understand that can be a bit inconvenient for you to have to come down again and to have a look over. But honestly, to really give you a proper price, that's really what we need to do. Now, they may ask, will I be charged for that consult? A lot of practices tend to have an introductory free giving a price. I mean, free estimate consults. We do that. And it's a good way of saying, okay, well, fair enough. Let's come and have a look. And then you try and win them over by having a good experience. Now, that's your practice has to have a policy on that. But it's a really good way of doing it. Some practices say, well, yeah, the consult's £55, £60, whatever it is, and that's that. Others say, well, the consult's £60. But you know what? On this first consultation with this, if you actually have the dental with us for this first time, we will credit that £60 back as part of the procedure when you do it. So you're no worse off, but we do charge to make sure we don't end up having lots and lots of free consultations. So different ways of doing it. But what you're really trying to do is get that patient registered on the diary in front of a vet. That's the best way to do it. And there's a few tactics to help you get that done. Theme number 5 then, of course, is working as a team to get the bill paid. Now, this is crucial, and I know receptionists are absolutely at the mercy of vets when it comes to talking about money and the client's reaction when you ask them for money. And it depends on how well the vets have set expectations of estimates and confirmed them before they get to the desk. And that's both as inpatients and outpatients. So this is this post-clinical stage when the invoice makes its way back to you, or you pick it up after a consultation or after an operation. Okay. I call the space between the consult, reception, and exit the Bermuda Triangle. Clients come out of this consultation. Some of them just disappear without trace. They walk out and everybody ends up stressed. You go, I don't know, is there something to pay? Is there something to do? Is there a follow-up? I don't know. The client kind of sometimes walks out and goes, bye, girls, heads out the door. And you're going, I don't know. Then the client, if you call them back, gets stressed. And then the vets, they're just hiding in the consult rooms. And then the bosses are going, why are people walking out without paying? Why are they not booking in those consultation or those operations that the vets are talking about? So it's really important. And I know the onus is on the vets to really hand this over. It's like a relay race and they have to take the baton to you. Sometimes, though, you have to go looking for it. And we know some vets are better at this than others. And so a really good receptionist is making sure the clients check in to check out. So they come back to reception and actually check in. I use a little acronym EIEIO. So I want my vets to estimate if any procedure is over a certain amount. We tend to use £100. I mean, that's virtually everything, of course. So giving an estimate for everything so the clients are not going to be surprised when they're asked to pay. I tend to inform the clients that the consultation is more than £100, maybe 120. So that I tell the clients before they get to the desk. So I bill it up, consult, injection, tablets, maybe £150. So just to let you know, Mrs. Smith, with everything we've had today, it comes to £150. Just one check. You're okay with that. There's some clients I don't say that to. I know they have no problem with it. All the clients, I don't say it for every consult. I don't want to say, I'll just let you know it comes to £60 because some of them will look at you and say, what, you think I can't pay? You don't think I can afford that? So it's a really good way, though, that they don't get to the desk because you guys will go, oh, that's £180, for example. And they go, how much? What's that for? And you have to feel this reaction. So it's really good if your vets can actually anticipate and just check. And we know that clients defer, and if the vet says the number, much more than they tend to have a bit more go at reception. So here's the phraseology in the consult. Just to let you know, blood sample consults comes to 120. Well, probably not with much of a blood sample nowadays, probably going to nearly 250. And just let you know that's okay. And clients are often, I will say, when I bring it up, they go, okay, so what's it for? Well, the blood's 150, the consult's 60, and the medicine's X. Oh, okay, fine. You just take that moment, and they're much better at accepting it when the vet says it. So our rule is receptionists should not be expected to resolve disputes over bills that you didn't create. How can you resolve fights about money that you didn't create? That's up to the vets who manage those expectations. But of course, we know since you're involved in asking for payment, they take it out on you. So we have a rule, if you bill it, you explain it. So the receptionist isn't the first person to tell a client if their bill is over a certain amount, £100. And that's for operations consultations. The first person to tell the client the balance of the bill over £100 should not be reception. And then we would like our vets to escort the clients back to reception. And if there's one single behavior that avoids the Bermuda Triangle problem, is the vets escort them back and hand them over to you guys. Or at least if you're on the phone or dealing with someone else, is actually say, okay, so Sarah, Jean, reception will be with you in a moment. And it's much better than them just disappearing out of the building. If you are available, I'll tend to tell you what follow-up I want. Can I see me again on Friday on anything? Or especially, for example, if there's a recheck, all they need to do is pay the recheck fee, but there's no follow-up or no medicines. Clients are much more likely to think there's nothing to pay. So I often will come out to reception and say, okay, Sarah, receptionist, Sarah, just to let you know, it's just a recheck consult today, no follow-up required. I'm not actually speaking to you. You can see it on the management system. I'm speaking to the client to go, come on, there's a fee. I've just sort of indirectly told you, get your purse out. So, I mean, can you book a check with Mrs. Smith for Scooby with me in X days' time? So very specific to make sure that the follow-up, to make sure the continuity goes. The number one reason why clients leave practices is a lack of vet-client-patient continuity. Okay. So just looking at follow-up compliance in relation to how it's done. If the vet books the follow-up consultation or the operation they're talking about in the consult room themselves onto the diary, there's a 90% chance that that client will book it before they leave the building. If the vet goes out and says to reception, Sarah, please can you book a dental in with me next week in a day that suits Mrs. Smith and also the day that I'm here, and I actually asked you in front of the client, 80% chance. If you're expected to read the notes and say, I see Brian has recommended a dental, let's get that booked in, 50% of them only will book in before they leave the building. And if the vets expect the client to go out to the desk and say, oh, can you go out to the desk and book in a follow-up consult or a dental or an op or whatever it is, 1 in 4 will actually do it. So it comes down to the proactivity of the vets, and they really can help you get that follow-up booked in if they take that initiative. So encourage them to do that. When we have new vets start, they're not great at this, and we have to encourage them. And we encourage our receptionists say, okay, come on, John, it'd be really great if you could come out to it after a consultation. Some of them will look at you like they've got two heads and say, you're joking me. I can't possibly come out of my consult room. Others will go, oh, yeah, okay, no problem. Sorry, I didn't even think about that. And they'll do it if you ask. So ask them nicely and point out how much of a difference it makes to you. O stands for if it's any details of administration, usually with an insurance that you might need if it's going to be a direct claim. So there you go. There's the clinical client journey. Again, in a nutshell, you're involved in preclinical and postclinical. I've given you 5 themed areas to think about, from understanding your involvement in the system, understanding the technical information syllabus, understanding clients in terms of converting them and being able to deal with resistance, and also dealing with price queries, and then finally booking in that follow-up consult and getting the bill paid. Okay, so hopefully you find those wee tips and tactics useful, and I'm now happy to take some questions. Well, the first thing I'd say is it comes down to the system. We use 20-minute consultations now. 10-minute consultations are absolutely obsolete in modern practice. You can't do any sort of decent modern practice veterinary job in 10 minutes. I would say 80% of practices run at 15 minutes, and certainly some vets will get behind. The answer to that is actually they need a consultation skills course. And guess what? Colourful CPD, in fact, it was my first one. Colourful Consultation is the course to help them with that. And usually it comes down to a combination of decisiveness and just situational management. And I'm constantly coaching vets on how to cope with when clients come in with a shopping list of 29 symptoms, and some vets seem to think that they got to solve them all in 15 minutes. So when they bring the shopping list in, I say things like, okay, goodness, there's a lot going on with Scooby. So just to manage where we are, we'll only be able to deal with a couple of those today. We'll deal with the most urgent, but don't worry, I'm going to see your follow-up recheck anyway. And don't worry, we'll go through all 29 on the list, and I look forward to helping you with all of that. But I manage it with, I'm going to do these two today. But I acknowledge there's a lot going on. Okay, this is a bit of a project. And we do. Some clients, of course, save up the lymph, the skin, the skin, the ear, everything for the booster to try and get 3 years veterinary advice in one booster consult. But that's just encouraging them to have the confidence to say, okay, that's just not going to happen today. I'm not trying to be difficult, but we can only do so much, and we'll do the most urgent symptoms. So that's really comes down to consulting skills. What you can do, though, of course, is help the clients who are coming afterwards or growling at you in the waiting room because the vets are running behind. And little tips and tactics are things like to say, okay, well, David's running about 15 minutes behind schedule at the moment, and he wanted me to let you know and apologize for that. So that's a better way, because, of course, they growl at you. Out comes the vet and says, sorry to keep you waiting. And the client goes, not a problem, not a problem. So you go, you're joking me. It was a problem for the last 20 minutes. So a little tip for saying it is, David wants to apologize. Sarah wants to apologize for late. Just let you know, she's about 15, 20 minutes late behind. So it's harder for them to go at you. But send them to a consultation skills course to be much, much more decisive and succinct. It's like treats, you have to treat them. You have to, sometimes some vets will just not do it because they're pecking away on their keyboard and they're writing War and Peace on notes. And it just comes down to the boss of your practice saying, guys, I promise you, if you worked in reception, you would appreciate how much help it would be to reception to take the baton back to reception and hand the client over. When you go to the dentist and you go to the optician, most of them will escort you back to the desk. And they're doing it, it comes across as if to be polite, but actually they're doing it to make sure, one, you don't leave without paying, and also to book in any follow-up. Sometimes it just has to be, come on, guys, I promise you, we're not doing this to be difficult. Some of them will never do it, and others just need to be asked and realized. Sorry, I missed the first minute of the meeting. Did I miss anything really important? Yeah, absolutely. It was all really important. And yes, you can watch this webinar as a recording. Just if you want to see the first minute or two, is just watch it back on the recording. Be a human. Be a human. Honestly, what I don't like is Disney receptionists or Disney vets. The person who's all saccharine and sweet, and they're pretending to be really sweet, and they're, oh my goodness, and everything. It just comes across as so insincere and so fake. Is you know how to behave with those people. You demonstrate empathy and sympathy. In other words, what's also important is to make sure that people out the back aren't laughing and cracking a joke because maybe they're totally unaware that something very sensitive is happening at reception, and people can be, so making sure that people out the back are within earshot of reception or waiting room, just say, guys, we've got a sensitive situation, just keep it down. That's also part of that management of the environment, but also for you is just phraseology, just, I'm really sorry for you. I'm so sorry we had to do that for you. Or, just, you don't even have to say stock phrases like, I know how much you'll miss them, because some of them can come across as contrite. As a human being, just how to be nice. Just, you'll say most of it with a gesture or a facial expression, or, just, I'm sorry for you. Okay. And you don't have to say much. Just ooze compassion, empathy, sympathy, condolence, but without over talking it. I'm sorry. Okay? Just be human. You know how to do it. No other questions outstanding, it looks like. Well, let's leave it there, unless anybody's diving in for the last one. I hope you found it useful. Quick rattle through of core things. The core standards on Colourful CPD, if you haven't done that course, and it follows on into the certificate, which follows into the diploma, it's packed with tips and tactics, just like I run through here, but there's far, far, far more content within those courses if you haven't already done it. Although there might be one more come up. Thank you. Okay, guys, have a good day. See you when I see you.